Welcome to the Inclusive Fitness Podcast, where we speak with self-advocates, caregivers, professionals, and other leading thinkers and doers who are working to shift the paradigm in how we think about and support creating healthy lifestyles for people who are neurodivergent, have intellectual disabilities or delays, or special healthcare needs. Join me, Greg Austin, the father of an autistic teenager and co-founder of Inclusive Fitness, as we learn together, inspire each other, and create a more inclusive world by building strength, confidence, and community. Hi, everyone. I'm excited to welcome Dr. Naomi Gauthier to our podcast today. Dr. Gauthier is a physician practicing at Boston Children's Hospital, specializing in pediatric cardiology. She's the director of the cardiac fitness program there and is an assistant professor of pediatrics, Harvard Medical School. Dr. Gauthier received her MD from the University of Massachusetts Medical School, completed her residency and chief year at University of California, Davis, and her fellowship at the University of Virginia. Naomi's research interests center around the range and plasticity of exercise physiology in congenital and pediatric acquired heart disease and the response to treatment via exercise therapeutics. Additionally, she is interested in the relationship between exercise delivery, resiliency, and positive health in terms of cardiopulmonary fitness, patient-reported outcomes, and longitudinal surgical outcomes. Welcome, Naomi, and thanks for joining us today.
Well, thank you so much for having me.
I'm super excited, and it's been such a pleasure to get to know you over the last, 2 years now, something like that, since we first met.
It was a pretty fortuitous meeting when we stumbled upon your Inclusive Fitness and then realized the synergy. And it has been nothing but nonstop since then.
Nonstop, both in terms of what we're both doing individually and the work that we're trying to do together, right?
Yeah, exactly. Nonstop, all involved, all of us.
Absolutely, absolutely. Well, it has been such a pleasure to get to know you and some of the members on your team. And I'm excited to talk to you about what got you involved in the space you're in, because as I read your bio, and I was doing some research on you earlier because I've known you for a while, but it's been a while since I've been on your bio, and I realized, wow, there is so much to unpack there, and there is so much background and so much expertise packed into your brain, and I'm super and I'm super
yes,
and I'm excited to unpack it with you, but I think what I was really hoping to do is focus on initially kind of what got you into that very specific space. What inspired you to study the area that you have devoted your life to, at least from a professional standpoint, and what still inspires you today? Can you tell us that story and kind of what got us to this point?
Sure. I guess that can be answered in sort of two realms. The first is my profession as a pediatric cardiologist. So that in and of itself is fairly specific. And I knew, I think from when I was fairly young, that I wanted to be a physician and that I wanted to work with children. So pediatrics was a pretty easy decision. I actually considered architecture. I enjoy the arts and creativity, but then realized that would be more a bit of a hobby, whereas pediatrics was much more of a calling. So that cemented my decision to go to medical school. And then since then, the realization that creativity has to be a part of what I do has manifested in various ways. And I think you can relate to that. And so when I was training, I actually didn't discover pediatric cardiology for quite a while. I have always been fascinated by the body, the way it moves, the way it works. And it was only when I finally was in my pediatric training that I came across pediatric cardiology. And it was just a perfect blend of being able to watch these children and be a part of their lives as they grow up, while also having really scratching my intellectual itch of three-dimensional visual spatial understanding of the heart and the body and how it works and puts together. And some of the procedural aspects where it's a bit more hands-on than some other fields. So it just all kind of came together as a perfect specialty for me. And I've studied the same exact organ for the past 25 plus years and still am not tired of it at all. So I guess it was the right choice. The exercise and fitness space itself was kind of a bit of a roundabout journey, as many journeys are. You suddenly realize that you're in a space that was 2 steps from where you were, but it took you years to get there.
I do understand that.
So the exercise space came about. To be honest, I'll tell you the actual story. So, I have been completely and utterly fixated on this idea of trying to promote what is possible for patients rather than what is not possible, to try to promote the positive, and the ability rather than the inability. And
Yeah.
through that, I considered different ways of doing that. We can get into this in more detail at some other point, but I started with a camp, an overnight camp for kids. So it wasn't a clinical program, but it was a way to, for kids with heart conditions specifically, it was a way for them to find what they could do rather than what they couldn't do. And as I did that, I realized that there was a lot of ways to impact children in this space. This was one. And if I really wanted to impact medicine, then I needed to have a more systematic operational way to do so. So I actually considered going to business school specifically for operations management and system development. And I applied, I got into Dartmouth's school, but there wasn't the support for me to do that at the time. So I pivoted and said, well, a lot of what I want to do requires that children feel successful. And to feel successful, you have to have body mastery and be included and play. And play to me is not frivolous. Play is the core of skill development and social inclusion. So I realized that, especially for my field where you have to think a bit about what exercise is going to do to the body and the heart, I realized I really needed to be an absolute expert in that. I needed to understand it so deeply that I could then prescribe, if you will, with knowledge rather than with guessing, if I was going to promote. And so that pivoted me completely to studying exercise in congenital heart disease in my field at Boston Children's, which led to my career there and subsequently to developing a whole field of exercise cardiology. So that is my story.
That is a heck of a story. And, I love hearing it from you. I mean, I know a little bit about your background, but I hadn't heard all of that. And I'm personally inspired to hear how you, not so circuitously, but, a couple of lefts, a couple of rights got to where you are, but all with the intent of becoming so good at what you do and so capable of helping people that you've created this specialty for yourself that is impacting so many people. And the story about the camps I had not heard before, and that's pretty neat. I'm kind of curious if you could maybe relate a story or two. It doesn't have to be around the camp, but around some of your earlier work where you were participating or working with some of the patients you had, and what sort of led to that bulb, that flash bulb going off in realizing, oh, this is truly empowering these people I'm working with, and I need to really commit myself, because I love what you said. And you said, I think you've turned it into a tagline, which we'll get into later, but you want to help people find what's possible. And at Inclusive Fitness, we talk about presuming competence, and I think these mesh so beautifully.
Absolutely.
And when did you see that? What was that spark? And when you realized that, oh my goodness, this is really important. This is a calling.
It was very clear to me. Actually, that's a very easy answer because it has literally fueled me for almost 3 decades. And it was when looking in the eyes of one of my patients who came actually in between me and his mother when we were sitting and talking in the exam room, and she had been asking me about maybe he can do soccer. I don't know. Is it too much? What should he not do? What should be restricted from? And he walked right in between us, looked me right in the eye and said, well, what can I do? And it just stopped me in my tracks. And I said, wow, there is an entire negativity bias in everything that we do in medicine to look only at what we should be restricted from, what is not possible, what is too much or too risky. Which those are important questions, don't get me wrong. Absolutely, we want safety first, but they should be balanced by hopes and dreams and aspirations and desires. And as you say, presuming competence. Just because you can't do one thing well doesn't mean that you can't do 5 other things wonderfully.
Right.
But if we don't ever point those out, maybe you never see them. And the relationship that we are privileged to have in medicine with our families is so strong and powerful that it really made me, it stopped me in my tracks and has driven me ever since to say, are we imprinting the right messaging on our patients? And if
Yes.
we are not, what do we do about that? And so literally from that moment on, I said, okay, well, we need to find a way to talk about and show both together. And this will resonate with you, I'm sure, because you do it
Yep.
every
Yep.
day in your world.
Mhm.
That we need to talk about and show these kids what they can do. And so that's actually what led me to forming Camp Meridian. Meridian was the name chosen because Meridian is a longitudinal line on a map.
Yep.
That's an anchoring line, and the ancient navigators would find the meridian in order to be able to navigate anywhere. So it was that idea that if you find your own
Mm.
meridian or your central self, you can navigate anywhere and you can explore, because there is some risk to exploring, right? You have to be able to go out, but if you're anchored
Mhm.
well, and if you have a strong sense of navigation, then you can go anywhere. Start here, go anywhere.
I love
So
that. I didn't know that. That's a beautiful
yeah.
way of explaining how you got to that name.
Oh, thank you.
Yeah.
So that's what drove me. And so it was literally year after year, we sat down and said, okay, our goal for Camp Meridian is to have people feel, these children with heart conditions. It was, you had to have a heart condition to get in. So like siblings were like, I want to have a heart condition because I want to go.
No, you don't.
No, sorry. So this specific group of kids, our goal was to have them come in to camp, whether or not they knew that how they were feeling at that time, that they would all walk out feeling successful that they can, and
Mhm.
whatever that meant. So there had to be a way that we could feel. It may have just been that they stayed away from home, because a lot of these kids had only slept in one of two places, which is a little. It's still is hard for me to say this, but it's true. They either have slept in their own beds or in a hospital bed. And that's it. Never.
I understand exactly what you're talking about. I'm sure many of our listeners can also relate to that in terms of not having had many or any opportunities for their children or even themselves, if they're self-advocates, to be in completely different and new environments. Maybe because they're medically fragile or because of anxiety or other behavioral issues. I get it.
Exactly. And
Hmm.
that exploration alone is a success, right? So sometimes that's what it would be, but it had to be other things. So we had to sit down and be very highly intentional with our programming and say exactly what do we want. So if we're playing a game of veggie tag, or if we're, what's something that looks very goofy, it was absolutely driven by intention. And we would sit down and write them out, and we would write down our values, and we would write down our value words, and we would write down exactly what we were intending to do while still fostering play and enjoyment and goofy fun. So with that, it was absolutely, I don't even know the right word, because no word is really strong enough, and you probably understand this well. Inspiring doesn't even touch it. It was magical.
Yeah.
To see these kids stand up at the fireside ceremony and listen to them use the very adjectives that we were aiming for without having
Yeah.
used those adjectives all weekend. They just got it,
Mhm.
because they were able to feel empowered, and they were able to use their bodies because there was built-in physical activity, but they were also able to feel supported and socially connected. And with those key elements, they were transformed, and they would stand 2.5 inches taller by the end of the 2.5 days. And
Wow.
so those were, I mean, I could tell you a million stories, but you don't have a podcast long enough.
We'll have to have you on. Don't worry.
Um, but those were really what drove me. And it, as a physician, I knew that what I wanted to do was to study that and understand how to distill the real salient drops of what was working, to be able to infuse them into the healthcare environment and use those lessons to transform the way we do healthcare in a systematic and operational way, back to kind of my original desire. So wonderful to do in a camp environment and really impactful, but it needs to come from the health system, and that's been my wheelhouse ever since.
Right. Yeah, exactly. And I wanted to use that as a jumping off point, because an amazing place to start, and I can completely relate. And I know that so many of the people we work with can relate to that, standing 2 inches taller when you have mastered something or accomplished something that to somebody else may seem minor, but is by no means small. It's all very, very relative. And I'd love to talk a little bit about sort of how you parlayed that into where you are now and the impact that that's been having and the impact you want to have. And if you could spend a minute also talking about the intersection between congenital heart disease and some of the neurological interactions that you've seen and some of the neurodiversity that you've seen, because I know they don't always overlap, but sometimes they do. And I know that's a part of your practice, and how that's impacted it as well, and kind of what's happening now, what's the impact you're having, and tell us a little bit about your current work.
Sure. So the lessons that I took from this whole concept of how do we help patients see and do in order to know what they can and what is possible. So with
Mhm.
those pieces in mind, I put those into the healthcare environment by creating a fitness program that was full fitness, so mental skills and physical activity combined, so not separate mind and body. I think they are one. And so we built them
Agreed.
into about, it was medically supervised, just like camp was. It was medically supervised so that there was clearly a safety level. It was dosed appropriately, just like medication. So we do a whole medical interview and assessment in order to know, just like any trainer will do, take a good assessment of where someone is starting from and then meet them there and provide them the appropriate dose, if you will, of exercise that is scaled to their needs and will also provide results. We were not about, you know, you actually use better terms than I do. You're actually quite skilled at this in presuming that confidence and knowing that this is not just for this is not a hand waving. This is to actually make them fit.
Yes, I think what you're getting at is this is challenging, and
Yeah,
this is
it's
actual exercise as opposed to kind of pat them on the head and say, "Oh,
yes,
you kicked the ball." It's like,
yes.
no, we're going to work hard. We're going to sweat, and what in a level that's appropriate for where you are, and then gradually challenge you.
Exactly. Real work, real rewards,
Mhm.
and that's because they can. And so
Yes.
not undercutting that.
Mhm.
So we created this program. It's built sort of off of the adult cardiac rehab model, so something that's familiar to many people, but very much recrafted to meet the needs of our patient population. And with a lot of the lessons that I learned from watching how carefully choosing language and opportunity and appropriate supports and measurement of progress, so which is very motivating to see your progression. We built those into the cardiac fitness program, as we call it, which is our supervised medical model. Patients that we see all have to have some sort of heart condition, which is what gets them in the door. But we have patients who have heart conditions do have a high prevalence of other diagnoses,
Mhm.
including a high prevalence of neurodiversity as part of their overall spectrum of care. So we have to adapt to different social communication styles, different learning styles, different levels of focus and attention. It is learning and education. Exercise is about learning and education. You have to
Mhm.
be able to learn, and it's
It's a skill.
yeah. And so we've had to adapt to various levels of interactions and anxieties and sensory considerations. We've actually turned to you guys and learned a lot to improve our skills, and are always looking to improve those, because I think that there is much to learn to do that well. But that is a part of what we adapt to. And just like you can point to amazing success. I remember one young lady, she was a teenager and had multiple open heart surgeries. She actually had a lung transplant, and multiple other considerations. And she had developmental challenges and enormous amounts of anxiety. And when she first started, she could get as far as the doorway, and she was scared of our stationary bicycle and would not come in. And she communicated largely through a stuffed animal that she carried with her. And so over time, and with the help of said stuffed animal, who wasn't scared of said bike, we slowly not only gained her trust, but not only was she riding the bike as the program progressed, but she asked her mother to buy one. She had one at home.
Wow.
And she made her put it in her bedroom. So that bike lived in the bedroom with her.
Talk
and
about
her.
a journey.
Yeah.
That's amazing.
Yep.
And I'm going to guess you have a few of those, not just a few, actually.
Yes, exactly. Yeah.
Yeah.
So many different. We have, everything from athletes who had setbacks and needed open heart surgery and all sorts of different various, to ones who never were given the opportunity to even put sneakers on. We have people who never owned a pair of sneakers because, I guess, without really thinking about it, they never really thought they had the need. Or their parents never really thought they had the need.
We see that too. And oftentimes we also see sensory issues or perseverations on other types of footwear here at the center. We've had athletes who've come in and they've never worn anything but Crocs or Uggs, or in one case, their mother's house shoes. Yeah, well, it's true, and very fashionable in some extent. So it sounds like that's a beautiful story of this one person who's been through this journey. And I'm guessing the impact, like I said, I'm sure you have many, many stories like that. How would you describe the sort of overall impact of the program you've been running? And how long has this been going on now, by the way?
So we started formally in January of 2017. That's what we consider our birth date.
Okay.
So we've been running continuously since then, with the exception of the pandemic, which obviously shut down our in-person operations, however, allowed us to pivot to developing virtual programming. So we now do a hybrid, which is part in-person, part virtual training. So not like our conversation right now, which we're doing by video conferencing, but actually training with the trainers on one side and the patients on the other, as if they were together exercising. So they're sweating. So it allowed us an opportunity to do that and to extend our offerings. And I think the impact has been enormous in various ways. So impact is always two-sided, right? You can't have an impact of only one thing. There's, like if you, I don't know, hit a ball, there's the hit thing and there's the ball itself, and the two of them impact each other, right?
Yep.
So I guess that would be called a bat, wouldn't it? The hit thing.
Well, I wasn't going to go there, but yeah, one would call that a bat. Yes.
Yes, I wasn't thinking of that. I had my vision on like a hand hitting a ball or something. But anyway, so the two sides that I think it's even more than two sides that are impacted, I think, are the healthcare side. Maybe we can say the healthcare side and the not healthcare side. Maybe I'll just put it that way. I don't know that I've ever divided it that way before, so I'm not sure.
Let's see where it goes.
I
like it.
So the healthcare side are all of us who are delivering this, right? There's both this enormous shift in how we are communicating with patients. We have to believe in them for them to believe in themselves. So we have to look hard at what we think and our own knowledge and grow our knowledge, and then be absolutely inspired and amazed by what we see and the direct impact that we have. So not only does that engender tremendous professional growth. There's me and several other physicians, but then there's also the whole exercise physiology team, who are the exceptionally talented people who are trained in understanding exercise science, as well as exercise training, and also the medical end of things with exercise delivery. And they're tremendously, tremendously talented. And they witness firsthand this transformation, this unfolding, just like we did at camp, watching these kids stand up at the fire. And that is, I would say, 1000% the antidote to burnout. There's nothing more powerful, I think, to realizing why you get up in the morning to do it again, and what you give, you get back in droves. So I think that the impact, not only just from a professional growth standpoint, but also inspirational stories, looking at your own life, feeling like you're making a difference, and staying connected to why you went into medicine, whether you're a physician or whether you're an exercise physiologist or whatever your role is, I think has been tremendous. And I'm not sure I could have a good measurement of that, but I can tell you I see it. From the not healthcare side, I guess I did a binary division that way because it's the patient who's impacted, but it's also the patient's family who's impacted,
There
and
you go.
wider
Right.
community. And so to start binary, because impact I said was two things, so I had to do binary. There was the stick and the ball. So the patient side of things, I love the fact that you call them athletes. So the athlete side of things, the impact has been measurable in multiple ways. So we believe in what we call 4 pillars of fitness. So this is training in aerobics, so endurance. It's training in strength, which you well know. It's training in flexibility, and it's also training in their mindset, that feeling of confidence. And so we actually have measurements of all of those things. So we have all sorts of benchmarks that show that the progress, and we graph it for them and show it to them at the end. So we've been able to show significant changes across those pillars. And at least for some of them in traditional medicine, those have been linked to health outcomes. So we can make the inference that by improving these metrics now, we're dramatically changing their health here forward. And what I am also sort of passionately dedicated to is trying to find ways to actually measure what I think are perhaps as relevant, if not more relevant metrics, which is how it's impacting the everyday, their ability to do well at school, to form friendships, to feel confident, to engage in the rest of life, just engagement in general.
Absolutely.
And
Yeah.
that's a little bit of a holy grail. We see it, but I have yet to figure out how to measure it well. So we're actively working on that.
Yeah, that's that. I just want to say that that is the holy grail, and of course we do know it, and when we see it, and we do see it.
Yeah.
And I think the thing you just touched on is so crucial. Starting to tie the two together. That is the consistent engagement in exercise and fitness, plus what that does in your daily life, how that makes your life better, whatever that may be for you, so that you can. We always talk about 3 things here: strength, confidence, and community.
Yeah.
And if you are stronger, then you have greater confidence. If you have greater confidence, you're more likely to be able to engage in your community. And they build on each other. And I love the fact that you, first of all, I love your 4 pillars. I think they just make so much sense. And I think people don't often think about, why do we do exercise? Why is this important? And you're defining it perfectly. Because these things, when you do them together in an integrated sort of wraparound way, you are improving this person's life on so many dimensions. And every single day. It's not just about getting stronger for stronger sake. Everyone thinks exercise good. Okay, yes, that's true. But why? And I love the fact that you're defining it, but you're also suggesting that those who have often been overlooked and left behind and thought, well, you probably can't do that, or if you can do it, it's going to be at a minimal level, are in fact probably needing it more than anybody else, and you're finding ways to make it possible for them, whether it's using a stuffed animal and getting a bike in the room, or running a camp. I think it's very inspirational.
Well, right back at you, because I think you see it every day, and I completely agree that it's this sense of what it does here and now. Yes, I want them to be healthier later. Yes, I want their hearts to be healthy. Of course, we all do. And we want them to age well and into the future. But everybody knows that. I want
I know.
now. I want them to be healthy today. I want them to be healthy on the playground. I want them to be healthy at the birthday party. I want them to feel confident. I want them to feel engaged. I want them to be able to carry their own backpack. I want them to be able to help somebody else. I want them to
Right.
feel, exercise is good for focus and concentration. I want them to do well in school because they're sending that blood to that brain, and they're helping to grow those cells, and they're helping to be able to focus and fill their heads with knowledge. And there's so many things. Their mood. I mean, it's an absolute inequity if they are not engaged. It's not just that they are missing a small piece of something. They're missing a grave part of childhood success. And you fortunately can catch up, just like, there are people who never had the opportunity to learn how to read, who can read as adults, and who have, amazing ability to think and reason and have beautiful thoughts, but don't have the communication skills that they can learn later. So it's not that you never can catch up in any way. But to me, it's not about, well, you don't have to do gym class, or you don't have to do a sport.
Yes.
It's not that. It's as if we said, well, it's hard to learn the letters and hard to learn to read. So, you don't have to do that.
Yeah, just watch TV.
Yeah. You can listen to it, and you don't have to learn the rest, because you understand. But it's sometimes hard to explain, and sometimes the words escape me in trying to.
Well, they don't escape you. You're saying it beautifully. I think this sort of leads me to an area I wanted to dive into, because you're working with medically complex individuals, right? Patients, some of who have developmental or neurological issues that need to be accommodated for. Here at Inclusive Fitness, we are working with people who are neurodivergent, whether it's autism like my son, Down syndrome, cerebral palsy, brain injury, or genetic disorder. Some of whom also have physical considerations that we have to look into and accommodate for. What I find, and I would love to get your perspective on this, because what we find is that many times it's not the athlete or the patient themselves, like the young man you mentioned earlier, who said, "What can I do?" It stepped in between you and the mom and said, "Don't tell me what I can't do. Tell me what I can do." One of the biggest, and this kind of gets to my next question, one of the biggest things we see as an obstacle or an issue we have to address is the sort of the expectations, or the lack of expectations, around our guys, around our patients and our athletes, not them themselves. I think there is certainly, and unfortunately, some learned helplessness that has occurred over time, because there have not been high expectations placed on a lot of our folks, because we work with people 12 and older, as you know, up to people in the 70s and 80s. But and it isn't too late to start, but it is harder. It's better if you can start younger. And if you were to say, what are some of the things that you've seen, and some of the ways that you would like to see things change in mindset, both from physicians and from parents or caregivers, that have maybe created a sort of this pervasive societal unconscious bias against expecting more from our guys? I would love you to kind of talk about that for a couple of minutes, because I believe that's one of the biggest things that we need to see changed over time. But I'd love to hear your perspective on that too.
Greg, we're so aligned on this. I could not agree more on so many levels. And I think this is where, like I said, an impact is two-sided. So I think the crux of the matter is what you said, which is that it's unconscious bias. It's pervasive because it's fairly hidden. It's not that there are people who say, "Oh, you can't do that," without any, based on their own thoughts. It's usually that they have come to that conclusion, and maybe they outright say it, maybe they don't, based on a whole host of verbal and nonverbal cues that they've been getting since they had the diagnosis given to them for their child, whatever it may be. And I think some of this comes down to, like I said, both the verbal and nonverbal cues. So if we start with the verbal, the language, all of the people that we serve, between me and my field and you and yours, do carry some type of medical diagnosis, right? They do have something that is setting them apart. So let's take neurodivergent for a second. That word divergent is not usually used to imply that it's going toward a good place or toward a better, aspirational place, right? It's usually used away from center. And away from center can be incredibly impactful. Many, brilliant people.
I was going to say, Einstein was away from the center. Yeah, Mozart was away from the center.
Exactly. You can wear that proudly. However, we're sending a message, right? In my field, we have congenital heart defects. We're telling them that their heart, the center of their soul, the life pumping action in the middle of their chest is defective from before birth. What kind of a hole are we putting them in? And how do we address that? And so there's so many, when you stop to look at it, they start popping out everywhere. And you start realizing that there can be just different ways. It's just like looking at all the words that you put on the wall in your gym space. You choose them in order to send a message, right? And you put them in big bold letters because you're sending a very loud and sort of clear message. So how many little words are floating around otherwise, either written or verbal, that are part of our language? And that if we could find a way to change that systematically, here I am back with my operations and systems, then I think we will have a huge impact, both in terms of how, for my world, the healthcare system first plants that seed about a diagnosis. If you put it and couch it in terms that is more balanced and use terms that are that have less, what's the word I'm looking for? That have less
baggage.
Baggage and judgment associated with them.
Yeah.
I think right there, it's a game changer, right? You call them athletes, right? Like you chose that for a reason. So we could do the same thing in so many different levels, and we could find ways of sending different messages. So in my world, parents are, you already have a little tiny baby coming into the world that you're supposed to be keeping safe. And then if you put inside their chest a heart that has some variation, that can be very scary, and you are supposed to keep them safe. And so how do you know if you're doing the right thing, especially when it comes to movement and exercise and running around, turning red in the face, et cetera? Is there a limit, or is there, like, what is safe? It's the same thing with many parenting decisions, but it's amplified times 1,000.
Yeah.
So there's all the nonverbal cues. Do we go, or do we, encourage?
Because our guys pick up on this stuff.
Yeah, exactly. And I always think about little sidestep example. My youngest son, so I have twins and then a younger boy, 3 boys, and my younger son, the twins always got, people coming up to the carriage because there were 2 of them. We had the big double wide and push them around and everybody. But my youngest was just a singleton, just one. And we pushed him in the carriage, but he had this sort of little chubby glow about him. He was always smiling, and he had big, round, chubby cheeks. And people would always come over and sort of peer in. We were living in Virginia at the time, so it was hot. So we had like the shade over his carriage. So we would have to like peer in down so they could see his face, so therefore he could see them. And they would smile, and he'd smile back. And it was always this reaction. I think from his eyeballs, what does the world look like? Oh my gosh, it's the most happy, smiley, wonderful place.
Look at all these happy people looking at me. They must love me.
All I got all day long was all these smiles. But then I walk by the ICU and I see our little babies in the beds, and the healthcare team is concerned and looking at them and examining them. And what do they see? They see concerned faces. They see a different look. And do we share the same nonverbal cues? And in what way are they picking up on that from very, very early on? And how can we just start to recognize that awareness? Everything starts with awareness, right? So how do we start with the language that we use and the looks that we give, as well as the belief systems that we carry, which is your presumed competence, and start to recognize that there are ways of addressing all of this. And as they grow, if you have someone with social communication disorder and they really do struggle, then there are rules and ways and tricks and, I don't know, like tactics to help. And so you can employ those, and you can employ those around exercise, just like you can employ them other ways. For someone with a heart condition, there's tricks and tactics, et cetera, to keep it safe and yet make it effective. And so there's always, I think, to address all aspects, to be able to recognize where you're starting from, meet them where they are, and then from there, allow them to rise.
Exactly. I completely agree. And we always say presume competence, and then as you said, meet them where they are, and let them be the people who are the ones who decide if there are limits. Your image of the little kids or the babies in a pediatric unit, with people frowning and concerned, brows are furrowed, all the Disney characters on the wall and all the balloons don't make up for that actual expression of concern that is absorbed. And they're like, okay, something isn't right with me. And I think about the people we serve here at Inclusive Fitness, and if it's always about, how do we fix you? What's wrong with you? How do we have to overcome these issues, as opposed to, I keep going back to that story you said, what can I do? Right at the beginning. All right. And not only that, but then this gets to the question of, how do we change to support you so that you are successful and you can do it safely, but also be challenged. That's the trick. I think part of the problem that I see here at Inclusive Fitness, and not here specifically, because actually we have all of our parents are amazing, but I see in the general population rather, is that there is a tendency not to presume competence, to be worried that they won't be successful, their kids won't be successful. And I think part of that has to do with not just concerns that have been embedded since the first diagnosis, but also the fact that there have been so few opportunities for their kids to be successful, because it isn't always easy work. And it does take some of those tricks you talked about. It does take that skill, that empathy, to be able to do it successfully and to support our athletes who may otherwise, not succeed in a typical environment, at least initially. Maybe they can graduate to a typical environment, but they might need a place where there's less sensory input. They might need somebody who is truly empathetic and can understand and really know how to back off, but also know how to challenge, how to compensate for maybe some behavioral or physical adaptations that are needed. Parents haven't seen that very much. And our society hasn't really kept up with, I think, the potential that our guys have, and instead has sort of taken the I don't want to say the easy out, but it has, I think, sometimes looked that way to me. That, well, they're hard to work with, so we won't, or it's too risky to work with them, so we won't. And at the end of the day, what's that?
Or we don't know how.
That's actually a really good point. Or we just don't know how. It's certainly not a decision that's always conscious. I don't think it is at all. I think, on the contrary, it's just that people haven't developed those skills. And this is a relatively new problem that we're facing, all told, right?
Right. Yeah.
So I know we're getting kind of close to our end of our podcast number 1, clearly, because we got to keep this conversation going if you'll indulge us in the future. But if you were to lay out like 2 or 3 things that our listeners, who are, I think, going to be many caregivers, some self-advocates, hopefully some of your colleagues, if you could lay out 2 or 3 things that you would love for them to feel, think, or do differently that would enrich the lives of the people we're supporting and serving, what would those 2 or 3 things be?
I think it would be, number 1, be consciously aware of the words that you hear and use, and the way that we sort of are looking at the world. And do we allow for possible, or are we closing ourselves off and presuming impossible? It's really down to your presuming competence. And if we become aware, just start with awareness. If we can just become aware of the number of times that the way we phrase things, or the way they pop into our head, or our own fears cloud, then you start to be able to stop and say, wait a minute, is there another way? And I think that's the second thing, is to open up to the possibility. So become aware of when our language or our thoughts are limiting, and then start to practice opening up to possibilities. So that might be like, well, I don't know if you can play soccer. Just add the word yet. So by adding the word yet,
Yes.
I don't know if you can play soccer yet, you open up an entire world of hope. As a matter of fact, your body feels immediately different. It's funny, if you try it and you just say it in your head, you immediately feel different, because what you're doing is you're opening up to hope. So it's
I love
such
that.
a beautiful thing, but just being aware of saying, seeing, feeling, thinking limited, and open up to possibility. And if you can start with those 2 things, then it is absolutely amazing where you can go from there. And I think that's what we did, and that's how we started, and that's how that little boy, his legacy has left, is just simple to say, wait a minute, why do we only talk about what I can't? And what if we talked about what I can?
I love it. So I want to recap that, because I think what you've said is profound. I really do. And I think it's something that we all need to practice. I need to practice more. So be aware of the way we speak and the messages that we've absorbed, and how we then maybe pass those through to the people we love. That's the first one. Did I get that right? Yeah. And then the second is see the possible. And I love the way you put it. Just add the phrase or the word yet. You may not be able to do that yet, but let's find a way to make that happen, and find the possible for the people you support, and as well as yourself, right? These are very powerful phrases. It's a self-affirmation.
Yep.
Yeah.
Yep, absolutely. So I think those are things that are profound, achievable, but profound. And yet they take a fair amount of work, because once you start doing it, you start seeing it a lot in a lot of different areas and a lot of different ways. And I think also recognizing that it's not necessarily the person or the self-advocate or the parent. It comes from all sides. It comes from this hidden unconscious bias through all of society. And I actually think that the medical system needs to take major ownership over that, because a lot of it does stem from our end. And so I pledge to fix that, if everyone else pledges to do their part too.
Okay, so unexpected surprise bonus question, and you get 30 seconds.
Okay.
With that very statement you made in mind, if you could write a postcard from the future to your present self about how things are different, what has happened because of that commitment you just made, which I know you'll do, what would that postcard say? What is the world going to look like in the future because of the work you're doing?
I think the postcard would have like the yellow brick road to Oz, and it would say, "We are all on the road to finding our possible."
Love it. And that's a great way to close off this very first podcast with you. Naomi, it's been a real pleasure. You've been absolutely a delight to speak to. And I've gotten to know you in a way that I didn't know before. And I'm so happy because of that. And I'm excited about where you're taking things and the work you've done.
Well, thank you, Greg, and I really appreciate the opportunity to speak and share some of these thoughts, and moreover to really pass on my absolute admiration for the work that you're doing. We really are united, and you are doing it right, and it's going to take a whole community of us to really make this difference, and find that Oz. So thank you for having me.
My pleasure. Here's to that yellow brick road. Well, thank everyone for joining us today. I hope it was as inspiring and as enjoyable for you as it was for me. Dr. Naomi Gauthier, I appreciate it. It was really fun, and I look forward to the next time.
Thank you.
Thank you.